Hello and welcome to Neckwise Clinics. My name is Dr. Drew Hall. I'm one of the co-founders of Neckwise. What we'd like to do over the next 15 minutes is give you a bird's eye view of what happens to most people in their lives as they go through it, what leads them to chronic health problems, the journey that they generally take before they get in our office, and once they end up in our office, what the procedure is about and how we correct structural problems in the neck to allow the central nervous system to work better and allow your body to heal, mend, and repair. About 20 years ago, I was trying to find a way to get through to patients, to give them, again, the bird's eye view of what we do in our office. Because largely we grew up in a healthcare system that only treats symptoms. They don't ask the question what the cause is, they just name it, they throw medications at you, and they never get to the root cause of what's going on. So again, over the next 15 minutes, I'm going to draw out what happens from birth to when someone gets into our office and how the upper cervical procedure, by correcting structural problems, can allow your body to function better and get to the root cause of why you're dealing with what you're dealing with. After practicing for 24 years, I've seen thousands of patients have chronic health problems of any different type that you can think about, either improve or completely recover by making specific corrections in the upper cervical spine, allowing the central nervous system to function better. So let's get into the bird's eye view of what we do. So before we get into the bird's eye view, look at what most people go through and how it relates to what we do in the office, I wanted to give you just a quick 3-minute explanation of what we do here at Neckwise Upper Cervical. This is your brain. It lies inside of your cranium, and that part of your brain is for running a business, doing math, being married, parenting kids, things of that nature, things that you consciously control. Now, this red area right here is called the brainstem. It controls all of your internal organ function. It controls balance. It controls muscle tone regulation, and basically everything else in your body, again, that you don't consciously think about. And so this is the most vital and important area in your central nervous system when it comes to your body's function and health. Now, from the second bone down, you have the spinal cord. And I always tell patients that's a piece of conduit that carries the information back and forth between the brain and the body. And so, where we come in as upper cervical chiropractors is right here. The head weighs 10 to 12 pounds. This yellow bone called the atlas, it weighs 2 ounces. And so we always tell patients you have a bowling ball sitting on a 2-ounce bone on the end of a stick. What possibly can go wrong? So because this is an unstable junction, it's the most susceptible area in the spine to structural misalignment, car accidents, sports injuries, slips and falls. Blunt type trauma can dislodge the top vertebra under the skull, and we're talking millimeters, so these aren't large misalignments. But when you have a structural misalignment at the floor of the skull from an injury, it tears the soft tissue and the ligaments that support the joints. The vertebra dislodges, it becomes locked, and it irritates this most vital structure. And at the other end of that is decreased function in the body, and this is where people who suffer with vertigo, cognitive problems, pressure and pain at the base of the skull, low energy, depression, anxiety, lots of different chronic health problems are coming from the central nervous system not working the way that was intended to, because this is what runs the whole show in the body. So what do we do in the office to fix it? First, the doctor will run you through a battery of tests to find out if you have this problem or not. Once it's determined you do have this problem and you agree to it, 3D imaging is taken to ascertain exactly how this vertebra structurally moved out of alignment. It's 1 to 3 millimeters. It can move out in different orientations based on the person and their joint anatomy. Everybody's built different. So the imaging allows us to know how you're out of position so we can then correct it. There's no yanking, there's no popping, and there's no jarring of the neck. The goal is to restore normal motion, and then over a course of care, over 12 weeks, we will check you to see whether you're in alignment or not. Sometimes you will come into the office and you will not need to be adjusted, and that's a good thing. That's our goal. But you should heal, mend, and repair over a period of time of keeping this clear, and we look forward to helping you. So this is what we call the bird's eye view of most people's lives. And again, the reason we came up with this is to try to give you a better understanding that the health problems that you have today usually didn't start when the symptoms started, but they started earlier. So let's get into it. This x-axis here represents your age. This is where you're born, and this is where you die, hopefully at 100 or 90 or 100 years old. So going this way, you're getting older. The y-axis is a function axis. Function is health. If you have 100% function, you're healthy. If you have 50% function, you've lost half your health. And of course, if you have no function, you're dead. So going downwards on the y-axis, you've lost function or health. Now, most of us, when we're born, we enter into the world without forceps or a vacuum extraction. But the first place people can have a spinal misalignment, actually, and we see lots of kids, are forceps deliveries, because they have 120 pounds of force exerted on the kid's neck when they pull them out of utero. And of course, it saves the kid's life sometimes, but it also can damage the neck and cause irritation on the cord and cause the body not to work the way it's supposed to. We're going to pretend that you were born, there was no forceps delivery, you came through the canal with no injury. And as you start to grow older, because your spine is clear neurologically, again, the brain controls everything in the body, and if there's no spinal misalignment in the upper neck, your body's going to work the way God intended it to. So as you start to develop and grow older, you're moving along this normal health 100% function chart. So at some point, you're 8 years old, you get a BMX bike, so you go over the handlebars, you hit your head into the concrete, or you're a girl and you're playing in a tree fort and you fall out the back of the tree fort, land on your head. So some trauma happens. It causes the top vertebra in the neck to dislodge. It becomes locked. It interferes with the central nervous system. And then what starts to happen is, because that upper neck is misaligned, you start to lose function. Now, you may get a sore neck for a day or two, or a headache for once or twice for 2 weeks, and then by and large, our bodies are amazing, so you keep trucking on and you don't feel bad. But you're not functioning at 100% and you're not really healthy. And this person, all the way back here, if they knew about it, they would get to an upper cervical chiropractor and get that structural problem corrected, so they don't end up doing what most people do that end up in our office, probably like you. So at 15, you have your first car accident. It's a minor one, but it causes another misalignment, more irritation through the cord. You start to lose more function. And about 3 years later, you finally drop below this arbitrary functional line, and you start to have your first symptoms. You get neck pain every now and again at school when you're studying. You're getting a headache once a week. You're finding your energy isn't quite as good as it should be. What do most Americans do here? They drink coffee for the low energy. For the headaches, they take Advil. If they have allergies, they'll take some over-the-counter medication. But they don't go to the doctor because it's not that bad, and the OTC medication kind of helps them feel better. This is how we're all trained in this system of healthcare that we grow up in. And if it's not addressed and maybe they have another injury, they start to further decline in function, and now they're having really chronic problems. They're getting headaches every day. They have cognitive problems and they're trouble focusing at work or at school. They're taking 2 hours to fall asleep 3 times a week. They're starting to have depression, and as things move on, they're starting to get anxiety because they're wondering what the heck is going on. When it gets more serious, what do we do in this country? We generally go to the medical doctor. So you go to your medical doctor, they take a blood test, they run all the, maybe they take an x-ray or a CT scan or MRI, depending on what's going on. Usually the tests come back clear, and they diagnose you with vertigo, with Meniere's disease, with migraine headache, with chronic neck pain, and then they write a prescription. But they never ask the question what the underlying cause is. And a lot of people, when they get about here and they're sick and tired of taking medications and they think there's got to be a better solution, they end up in an acupuncture office, an upper cervical chiropractic office. They change their diet, they meditate, they're doing something to try and help their body work better, to allow it to function better so it can heal. A certain percentage of them get into our office. You end up in our office right here. We're going to run you through a battery of tests to find out if you have an upper cervical misalignment. If you do, and you want to move forward, we will then take 3D imaging to find out how you're out of alignment. Why is this important? Because the central nervous system controls everything, and when the upper neck is out of position, it irritates the cord and it decreases your body's ability to function properly. So by correcting you over a period of time, we get you corrected. What's going to happen when the irritation is removed off the cord? The body will start to respond, it'll start to move towards higher function, and it will start to recover to the best of its ability. The sooner we catch you below this line, the quicker you're going to recover. If you've been chronic for a long time, it may take weeks and months, and yes, in some really long-term, long-standing chronic problem patients, it can take years before they completely recover. But what we find is most people, within 12 weeks, they're anywhere from 40 to 80% better symptomatically. So we have you under a course of care. We're monitoring whether you're in alignment or not. After 12 weeks, you will graduate. We will put you on less frequent care to continue to monitor, to allow your body to continue to heal and mend and repair, with our goal being getting you as close to this normal functional level as possible. And once they're here, we put them on what we call wellness care. That's where we check them very infrequently, kind of like your dentist, so you don't go back and lose any health. So we hope that this video has helped you understand what we're trying to accomplish in the office. It is not an overnight fix. It does take time. This is a powerful area. If it's corrected properly, you can and will improve, and we look forward to helping you.